Hello everyone. Today I'm going to discuss about the blood diagnostic test. So in the last class also we discussed during the introduction to diagnostic test, what is diagnosis, what is the diagnostic test. So we discussed what is the criteria for the diagnostic test and also different types of the diagnosis we already discussed. So this also another diagnostic procedures, especially the for the blood. So different types of the blood diagnosis tests are available. So we are going to discuss one by one how is going to be helpful to detect the disease. So here I'm going to discuss about the different varieties of the blood test. So especially this going to be has to be done in the like a investigation procedure place, which is called as the laboratory. So the most common type of the blood disorders are blood test. We are going to some infections or inflammatory conditions. So many things we are going to find out through these blood tests. So blood tests are commonly used diagnostic tests that can provide valuable information about the hematologic system and many other body systems, not only the blood disorders. The first one is the complete blood count. So this complete blood count is going to be the blood test. There's a CBP, also called as the CBP, complete blood picture. So here specimens of the venous blood are taken for the complete blood count, that is CBC, also CBP complete blood pictures, and also which including the HBB, so HGB, and also hematocrit measurements, erythrocytes, RBC, and leukocyte count, red blood cell indices, and also differential white cell count. So these are the so many different types of the blood test. So these tests are going to give the proper information about the condition. So first one is we are going to check about the hemoglobin. So this is the main intracellular protein of the erythrocyte. So that is the heme and also globin is combined together. Is nothing but is erythrocyte protein. So is going to form the red blood cells. So if any reduction in the red blood cells, so it may chance to get the difficulty transporting the oxygen, because of the main blood function is the transporting the oxygen. So because of the any abnormality in the hemoglobin, may give the complications. So it is the iron containing proteins in the red blood cells. So they transport the oxygen throughout the body. If any defects in the hemoglobin, so may chance to get the so many complications such as in the anemia and also polycythemia and maybe leukemia, so many different type of symptoms, problems we are going to face. So with this one, so we are going to identify the different type of the complications in our body. So that's the reasons this is going to be rule out the what are the causative factors in the abnormality in the blood. Coming to the hemoglobin test is a measure of the total amount of the hemoglobin in the blood. So supposed to be is the normal hemoglobin in the men. So it's around the 13.5 grams to the 18 grams per deciliter is the normal value in the men. But in the female and the women, so it's going to be 12 to 15 grams per deciliters. So this is the normal. So sometimes if the value is increased, it is called as the polycythemia. So in case of if the value is decreased, the RBC count is decreased, so which is called as the anemia. So many different types of anemias are there. So just here we are discussing about the only what are the blood tests are available to check the complete blood picture. So this is also about the hemoglobin test. And also next about the hematocrit test. So this is a measure the percentage of the RBC in the total blood volume. So we are going to check how much of the percentage is there. So this is a normal value for the both hemoglobin and also hematocrit vary. So with the males having the higher levels than the females. So males are going to have the higher than the females. So this one is going to be in the men 13.5 and also the 13.5 to 18 grams per deciliters. And in the women is going to be 12 to 15 grams per the deciliters. So that is the hematocrit and also hemoglobin percentage. So why we have to check these things? So if you want, if any patient comes with any like the patient is looks like anemic or weak, if the patient is dull because of the anemia, so many may chance to get maybe we may chance to get the severe cough symptoms or maybe the malaise or weakness, and also may chance to get the other complications related to the heart function also may be altered. So that's why we have to check all the like a percentage, then only we can rule out the conditions. So next one is the blood count, the complete blood count, and also hemoglobin and also hematocrit increase with the dehydration. So if the water content is lost, if the water loss, and also as the blood becomes the more concentrated, if the more concentrated, so this hematocrits and also hemoglobin percentage is going to be increased, and also decreases with the hypervolemia and also resulting in the hemodilution. And also is going to be the hemodilution. So these are the major causative factors for the increasing the hemoglobin and hematocrit, especially for the dehydration. And also hypervolemia is the decreasing the HB percentage, hemoglobin percentage, and also hematocrit percentage. So these are decreases with the hypervolemia and also resulting the hemodilutions. So if it is the hemodilution, so the blood percentage, the hemoglobin percentage is going to be decreased because of the hypervolemia. That means increase the volume. And also another blood test is going to be RBC count. So we are going to count the so this one is next one is the complete blood count. In this one, RBC are going to checking. So here is going to so RBC. What is the RBC? The red blood count. So which is the number of the RBC per cubic millimeter of the whole blood. So if you see, if you observe the blood, in the blood, the fluid is going to be around 45% in the out of 100% is going to be the blood. So in this one, the 55% is going to plasma. So here, so how much the RBC percentage is in the blood cells? So that is going to be RBC count. So low RBC counts are indicative of the anemia. So that means if anybody having the less HB RBC count, so it is called as the anemia. And also clients with chronic hypoxia may develop higher than the normal counts. So this condition known as the polycythemia. So that means in case of if the increasing the red blood counts, if it is more than like the hemoglobin and also if the red blood cell count is increased, so that condition is called as the polycythemia. And it's if the less condition, if it is the amount of red blood cells in the body, so it indicates it is called as the anemia. So what are the normal values here? For the men, is we can see here is going to be 4.6 to the 6.6 million millimeter cubes. So this is going to be within the millimeter cubes. So the percentage going to be the 4.6 millions to the 6 millions. So and also in the women is going to be the 4 million to the 5 millions. So this is the normal value. So that means if it's less than like a 4 million or it comes to below the 4 millions, so they may chance to get the decrease the red blood cells. So they may chance to get the anemia. And also next one is the leukocytes are also called as the WBC cells. So W is the white blood cells. So these are like if it's mainly is helpful in the phagocytosis. So that means the defense act as a defense mechanism. So if any bacteria or virus entered our system, so these white blood cells are going to be working as a soldier. It's going to kill the bacteria and virus. So it helps in the improve the immune system. So that's why if anybody having any infections, so this count is going to be increased. So because of the soldiers count is going to be increased to protect the system. So it mainly helpful in the our improve the immune system. So here, if you see here, the normal counts is determines the number of circulating WBC per cubic millimeter of the whole bed. So this information is useful in diagnosis of certain disorders that have characteristics pattern of the distributions. So if anybody having any like a infectious disorders, and also if the special characteristics are the characteristic pattern of the distributions, so we are going to found with this WBC counts. So high WBC counts are often seen in the presence of the bacterial infections. By contrast, WBC count may be low if the viral infection is present. So that is the variations. If it is viral infections, so the WBC count is going to be decreased. If the bacterial infection, the count is going to be increased. In the differential diagnosis, WBC differentials and also leukocytes are identified by the type and percentage of the each type is determined. If you see the WBC, so many different types of the WBC cells are there. So these WBC cells are going to give the so different like numbers are there. So if you see the basophils and also eosinophils and neutrophils are, and also lymphocytes and monocytes. So these are all the five the different varieties of leukocytes are there. So that is the white blood cells. These are going to be the different like a number in the different conditions. So according to the condition also, that those numbers are going to be vary. Maybe lymphocytes, maybe eosinophils are going to be increased in the particular condition, different conditions, or basophils are going to be increased in different conditions. So according to the increasing the number of the leukocytes also, so we can diagnose the condition, what type of the problem and what we are going to do for that condition. And also this the normal value. If you see a normal value is the 4,500 to the 11,000 is a millimeter cubic. And also this is both will be in the male and female are going to be both same. So that is the complete blood count about the WBC count. And also next about the platelet count. So this platelet counts also are platelets also known as thrombocytes. So thrombocytes is the main function of the thrombocyte is mainly helpful in the bleeding blood clot. So if any bleeding occurs, so these thrombocytes are going to be helpful to form the blood clot. So like a patch is going to be stick to the blood vessels. If any cut is there, any leakage is there, is going to stop the blood circulations. So they circulate the bloodstream and bind together to form a clot over the damaged blood vessels. Determining platelet count is a vital in assessing the patients with for the tendency of the bleeding and also thrombosis. So if anybody having any thrombosis problem, that means any blood clot, or also maybe tendency bleeding disorders, so this platelet is very, very important. So next one is the normal range. If you see the normal range of the platelet counts, so it will be is 150,000 to the 350,000 is the normal value. So if it is more than this much of value, so if it in case of any thrombocytopenia, so they may chance to. So in those conditions, the value is increasing. Or in case of any severe infections, or is a urinary tract infection, or maybe dengue fever. So some type of like a serious complications, this platelet count is going to be reduced. So that is about the platelet count.